So one of the challenges I've faced over the last 20 plus years as I've focused on quality improvement within healthcare is how do we go about standardizing a clinical process that involves physicians? And there are really, when you're involving physicians, there are these 5 key points that you need to follow to develop standard clinical practice or standards of care. You need to engage the staff that are practicing in the development of those clinical practices. You need to go and observe the actual clinical practice and all the variation that is inherent in that practice to learn from it. And then ultimately, you want to go to the published literature, what's evidence-based best practice, and try to incorporate that into the protocol as you develop it. Unfortunately for us, most of what we practice, there's not clear, irrefutable evidence in the literature saying this is best clinical practice. So more often than not, you are left with a situation where the protocol is developed through a consensus-based decision-making. But again, it involves the frontline staff in coming to those decisions. Once you've established a clinical protocol, a standard practice, it's then incumbent upon the leader in that local area to really focus on making it easy to follow the protocol, easier to follow the protocol than deviate from the protocol is ultimately what I try to do. To achieve those goals, it's typically most effective when the protocols are developed locally in local work units, and ideally to facilitate compliance with those protocols, you want to embed them into the electronic health record as much as possible. So you can see step number 1 is staff engagement. So how do we focus on engaging staff? Well, ideally, my approach is, as a leader in a work unit, I say, here's a problem we as a group need to address. Is there anyone interested in working on that problem? I seek volunteers. And typically, those volunteers are change agents, so to speak. They typically are more accepting of change because they're typically frustrated with the current practice. But having someone who volunteers to participate, a peer, is really, really critical step in getting engagement of the others around them. The next step for that volunteer is to observe peers in practice and then complete that literature review, looking for that best evidence, creating the draft of the protocol, the guideline of care that they're trying to create, and then they present that draft to the group for discussion, and then ultimately through a consensus tools, which I'll just show to you in just a few minutes, the group comes to a consensus and agrees to the protocol that they will then follow and use for further improvement. For many physicians, they're very, they practice in a silo. They practice one-on-one with their patients, and they have very little knowledge about what's going on around them and how their peers are actually practicing. And so you really almost have to teach the physician peers how to go and observe the clinical practice and what are the key elements. So we teach them to clearly define all of the steps in the process or the procedure that they're looking at. They need to note the sequence of steps. Then ideally, when there's variation in the steps, identify where that variation occurs in both content and sequence. And ideally, we help them draw a simple little map of what the current state process looks like. And then through their protocol that they draft, what their target condition process map would look like.